Welcome back to Ticker News. Well, this Wednesday is a major moment for Clarity Pharmaceuticals. The biotech company will list on the ASX for the very first time after one of the largest capital raisings for a biotech IPO in Australia. For more, let's bring in Dr. Alan Taylor, Executive Chairman of Clarity Pharmaceuticals. Thanks so much for your time today.
Oh, thank you. It's great to be here.
So firstly, why now, I suppose? Why are we jumping on the ASX at this point?
Look, we came from very simple beginnings. Roughly 8 years ago, we're nothing more than a couple of provisional patents. We've grown the company now quite significantly. We're running 5 clinical trials, both in Australia and the US, in kids' cancer as well as adults' cancers in both males and females. With those 5 clinical trials going, it's really the right time to move to the next step of what is the usual process of an Aussie biotech, and that is to list on our local exchange.
Exciting times, no doubt. So tell us a bit more about that growth that you touched on. Was this all going to plan? Was it a bit surprising in some ways?
Oh, look, it's been an evolution over time. When you're starting off with just some patents and some early technology, it takes a while to evolve that to first in clinic and the like. So we did our first clinical trials because the predominance of the IP coming out of University of Melbourne went across the road to the Peter MacCallum Cancer Centre, first in human, started to characterise that and move that into a broader range of trials. So now we're in breast cancer in women, prostate cancer in men, and as I said, neuroblastoma, which is still one of the biggest killer of kids under 5 as a cancer. So it's an incredible period of time, and it just so happens that radiopharmaceuticals, the area we're in, has become very topical of late. Because of really the efficacy we're able to achieve with this specific targeting of cancers, which makes it a lot more safer and a lot more effective to hit the tumour, eradicate the tumour, and then obviously better treat the patients.
So in terms of the work that you're doing, has it been done before? Are there competitors out there, for want of a better term, or is this really a space that you're focusing in on to own in many respects?
So it's relatively new. It's in an area of precision medicine, which a lot of people have focused on over time, but there's really only one product to market to date, which is called Lutathera, endocrine tumours, that uses the similar sort of mechanisms that we use. There's a few groups in development at the moment, but because of the excitement around the area, there actually aren't that many clinical stage companies, because a lot of them have been acquired by the large pharmaceutical companies. So look, we're looking to grow in what is an exciting market, which is still niche, but really it's barely scratching the surface of what is a very large oncology market. To really, shift away maybe from the old ways of using chemotherapy and surgery and external beam radiation to more these understanding the biology of the disease and specifically targeting the cancer itself.
And just finally, one of the largest capital raisings for a biotech IPO in Australia. Tell us about the process.
Yeah, it was rather overwhelming. My background prior to joining Clarity, even though I'm a scientist by training, was actually in the markets in investment banking, and I listed a number of life science companies previously. Having the largest is quite a milestone as an Australian company. I think that's quite exciting for Australian science to achieve that. But for us, really, it's raising sufficient capital for us to achieve our milestones over the next few years, which is bringing these products to market fundamentally and driving out the value in our whole paradigm of this copper pairing to treat cancers. So yes, it's the largest IPO, but really the focus for us is fundamentally to grow our company from the bottom up and progress these products through, which is through to our ultimate goal of better treating kids and adults with cancer.
Amazing. We're all here for that. So keep us up to date. All the best with Wednesday and all the work moving forward. How can we keep track of what you're up to?
Yeah, sure. We're going to be listed. So we've got a ticker, CU6, and so easy to follow for us. Follow us on the ASX. And obviously there'll be a number of announcements coming out over the next 6 months, which is constant feedback on the clinical trials, the 5 clinical trials that we're progressing.
Great work. Great to chat today, and hopefully we'll talk soon. Thanks, Alan, for your time today.
Wonderful. Thanks, Adrian. Bye.